The second part of Chapter 28 is going to deal strictly with charting symbols. This is where you're going to use the charting forms that were passed out to you in class. You're going to use these as practice while we go through the different symbols. Now, the first thing to know about charting is each dental office is going to follow what the doctor prefers for their charting symbols. So what you're going to learn here in class are some basic examples, but just be aware once you are out in a dental office, you could come across variations for these types of charting symbols. The first one we're going to discuss is amalgam. Amalgam refers to a silver restoration. Amalgam restorations are commonly used to restore teeth that have had decay or have possibly had a fracture or a chip. In the examples here, and these are found in your textbook, we have a typical amalgam charting symbol. In this diagram, you see a red circle, and the red circle is completely filled in. By filling in the circle, you're indicating that this is an amalgam material. Now, amalgam restorations, along with composite, which we'll talk about next, you're going to draw where that restoration occurs based on the abbreviations that we just learned. So when you look at a tooth chart, you're seeing the buccal side of the tooth, you're seeing the occlusal surface of the tooth, and you're also seeing the lingual surface. You're seeing all three surfaces for posterior teeth. Because this red circle is on the occlusal surface, we would call this an occlusal amalgam. Now, think back to the color coding. If this amalgam is red, it indicates that it needs to be done. On this next image, we're seeing a tooth. Again, we've got the buccal side, the occlusal side, and the lingual side of the tooth. This restoration is much larger. It actually spans from the mesial side of the tooth all the way to the distal side. So this specific amalgam restoration is going to be called an MOD because it covers the mesial, occlusal, and distal surfaces. Again, we outline the area that the restoration takes up, and because it's amalgam, we color it in. Now, this specific color coding is blue, and remember back to the color coding that we talked about, blue refers to a restoration that is completed. This third diagram shows again the buccal, occlusal, and lingual sides of a premolar. In this example, we see a red area at the neck of the tooth. This is an example of a class 5 restoration. Remember, class 5s are at the gum line. This specific example is red, so this indicates that this is a class 5 amalgam restoration that needs to be done. Now what you will want to do is go to your charting paperwork. The first example on the first page refers to amalgam restorations. Now, to conserve space, you'll notice that the tooth chart is only one quadrant. That's okay, you can still practice charting using a single quadrant. What you're going to do is chart the indicated amalgam on the proper tooth. For example, the first tooth listed is tooth number 1, and that tooth needs an occlusal amalgam. Number 2 needs an MO amalgam. Remember, M stands for mesial, O is occlusal. Number 3 needs a class 5 buccal amalgam. Number 4 needs an MOD amalgam. Tooth number 5 has a distal occlusal amalgam. So here you'll have to change your color from red to blue. And number 6 has a lingual pit amalgam. So take a few minutes to properly chart those amalgams on your charting paperwork. And then when you're ready, you'll want to unpause the video and I will show you what the chart should look like. So this is what your amalgam practice charting should look like. Take a minute to review. Remember, amalgam restorations are colored in a solid color. If it needs to be done, it will be red. If it has already been done, it will be colored blue. And then you just have to practice placing the restorations in the proper location. Example number 1, your amalgam should be placed strictly on the occlusal surface. Number 2 is an MO amalgam. So we want to make sure the amalgam reaches the mesial surface and extends onto the occlusal surface of the tooth. 3 is a class 5 buccal amalgam. So make sure that the amalgam is on the buccal side of the tooth. Number 4 refers to an MOD amalgam. So make sure that your charting reaches the mesial, goes across the occlusal, and ends on the distal side of that particular tooth. Numbers 5 and 6 have already been completed, so those will be blue. 5 has a distal occlusal amalgam, and 6 has a lingual pit amalgam. So your practice tooth chart should closely resemble what you see here. Now, if you're having a little bit of trouble orientating yourself to this quadrant, think about the dotted lines that you see here. The vertical dotted line refers to the patient's midline, and the horizontal dotted line refers to the separation of the maxillary arch, which you see here, and the mandibular arch, which is not visible here in this diagram. I also like to think of that horizontal dotted line as the patient's tongue. Remember, lingual refers to the tongue side of the tooth, so the image here that's closest to that horizontal dotted line is closest to the tongue. So this side of the tooth is the lingual side. And of course, the sides of the teeth that are closest to this vertical dotted line are the mesial side. Remember, mesial is closest to the midline. The next charting example that we'll cover is composite. Composite can also be called resin. It's the exact same material. Now composites and resins are tooth colored, and we chart them very similar to the amalgam restoration with one key difference. We outline where the restoration is needed if it's in red, and it's just an outline. We leave the inside of the symbol the same color as the paper that the tooth chart is on. That way it's telling us that this restoration, here's the border, but inside the restoration it's the same color as the surrounding natural tooth structure. So when you see this symbol on a tooth, just a circle that is not colored in, you're going to know that this refers to a composite restoration. The second example here, again, is composite. This one, however, is an anterior tooth. Typically on charting diagrams or tooth diagrams, anterior teeth are only shown as having two surfaces because anterior teeth do not have an occlusal surface. So here we see a buccal side or facial side. Remember, buccal and facial are interchangeable. And this part here is the lingual surface of the tooth. This outline is on the mesial facial side, so this would be an MF composite, and it's red, so this one needs to be done. This example here, we're on a mandibular tooth, so we actually flip the reading. So this is the buccal or facial side of the tooth, and this portion is the lingual side. Again, we look at the outline, and we see an outline that goes from the mesial side, covers the facial side, and it goes to the incisal edge of this tooth. So this would be an MIF composite that needs to be done. And the last example here, again, we have another mandibular anterior tooth. This one is a canine. Here is an example of a class 5 composite. Remember, class 5s are at the gingival third of the tooth, right around the neck of the tooth. This one is charted in blue, so we know this is an existing composite class 5 buccal restoration. So now you're going to pause the video and take a few minutes to properly chart composite or resin restorations on your practice charting paperwork. Now that you've had time to practice, I will show you what your practice charting should look like. It should closely resemble what you see here. Tooth number 1 shows an occlusal composite that needs to be done. 2 is an MO composite that needs to be done. 3 is a class 5 buccal composite that needs to be done. 4 is an MOD composite that needs to be done. 5 is a DO composite that is already complete. 6 is a lingual pit composite that is already completed. 7 shows a distal incisal facial, so a DIF composite that's complete. And 8 shows a mesial, incisal, facial, and lingual composite. So this one actually has 4 surfaces involved. We have our mesial, it's closest to the midline. It spans the facial surface, it touches the incisal surface, and it goes onto the lingual surface. So this is an MIFL composite. The next charting that you're going to practice is recurrent decay. Recurrent decay indicates that decay has returned or has been reintroduced around the margins of an existing restoration. Now, recurrent decay can be found on any natural tooth structure that has a restoration on it. In the diagram shown here, we have an amalgam restoration. This is our MOD, amalgam restoration. And to indicate that there is recurrent decay, we're going to outline that restoration in red. So what you're going to do is take your practice charting paperwork and practice charting recurrent decay. So pause the video for a few minutes while you have a chance to chart recurrent decay. All right, now that you have had a chance to practice charting recurrent decay, this is what your practice charting should closely resemble. This is also good practice for charting amalgams and composites. Number 1 is an occlusal amalgam with recurrent decay. 2 is an MO amalgam with recurrent decay. 3 is a class 5 buccal amalgam with recurrent decay. 4 shows an MOD amalgam with recurrent decay. 5, 6, 7, and 8 all show composites. 5 is a DO with recurrent decay. 6 is a lingual pit with recurrent decay. 7 is a DIF with recurrent decay. And 8 is an MIFL composite with recurrent decay. The next symbol that we're going to practice is a porcelain fused to metal crown. When we chart crowns, the typical symbol that we use is we outline the entire coronal portion of the tooth. So for example, here we have a posterior tooth. We outline the coronal portion of the tooth, both on the lingual, occlusal, and buccal images. By completely outlining the coronal portion, we're indicating that this restoration covers the entire surface of the crown. Next, we have to be able to distinguish between different materials. Porcelain fused to metal indicates that this crown has both porcelain on it, which is nice and tooth colored, and it also has metal on it. Typically, the only metal that you're going to see on a porcelain fused to metal crown is this thin metal collar, which is always on the lingual side of the crown. Now, since porcelain is tooth colored, we're not going to color or make any symbols on the areas that are strictly porcelain. So there we just have an outline on the anatomical crown. However, we do want to indicate that there is metal on the lingual side of this crown, and we're going to show that by placing diagonal hash marks on the crown of the tooth. But remember, that's only on the lingual side. Now, diagonal hash marks are very specific. They're used to indicate precious metal. So if you see diagonal hash marks on a tooth, that's an indication that the restoration on that specific tooth is made out of a precious metal such as gold, platinum, or palladium. So take a few minutes, pause this video, and practice charting porcelain fused to metal crowns. Alright, now that you've had a chance to practice charting PFM crowns, here is what your practice charting should closely resemble. So since we're drawing crowns, they should all be blue. We're charting as if they're existing. Remember, porcelain fused to metal, we outline the entire anatomical crown of the tooth. The sides of the tooth that are porcelain, we don't do anything with, we just outline the crown. However, on the lingual side, we're going to put diagonal hash marks to indicate that that restoration has a precious metal attached to it. The next symbol that you're going to practice is a full cast crown. It's abbreviated FCC. Full cast crowns refer to a crown that is completely made out of metal. There's no porcelain at all on these crowns. Typically they're either gold or silver in color depending on the content of metal. Now, because there is no porcelain on the tooth, you're going to use diagonal hash marks on all coronal portions of the tooth chart. So on this specific tooth, we outline the coronal portion of the buccal, occlusal, and lingual sides of the tooth. And because every surface of the tooth has a metallic look to it, because it's all metal, we're going to put diagonal hash marks on it. So take a few minutes, pause this video, and practice charting full cast crowns on your practice charting paperwork. Now that you've had a chance to practice, this is what your full cast crown charting should look like. Now that we've switched to a different page, I've actually imaged a different quadrant here. So now we're actually looking at the patient's lower right quadrant. So now the buccal side is at the bottom edge, the occlusal is still in the middle, and the lingual is now at the top edge. But if you just stick to the horizontal lines here, remember the side of the tooth closest to that dotted horizontal line is the lingual surface. So hopefully what you've practiced charting with full cast crowns looks similar to what you see here. The next symbol that we're going to practice is the symbol for sealants. This is a very simple symbol. You simply place an S on the occlusal surface of the tooth that has the sealant. Now, sealants are used to help prevent against decay on the occlusal surfaces of teeth. Now, I really don't like what the book has used here. They used a black S. What we want to do for our class purposes is only use black to indicate conditions. Since a sealant is not a condition, it's a man-made material that's placed on a tooth, we're going to chart it in red if it needs to be done, or we're going to chart it in blue if it has already been placed on the tooth. So pause the video again and practice charting sealants. Now that you've had a chance to practice charting sealants, this is what your practice charting should look like. We have completed sealants on teeth numbers 30, 31, and 32, and teeth numbers 28 and 29 have a red S indicating sealants need to be done on these two teeth. Next we have a stainless steel crown. Stainless steel crowns are typically only placed on primary teeth. This is another very easy charting symbol to use. And I will show you a variation, but what our book shows us to use for a stainless steel crown is the letter SS, which stands for stainless steel. Again, I would like you to use red S's if it's a stainless steel crown that needs to be done, or blue S's if it's a stainless steel crown that has been placed. For some reason, the book has charted it using black. So take a few minutes, pause the video, and practice charting stainless steel crowns. Alright, now that you've had a chance to practice charting stainless steel crowns, this is what your practice charting should closely resemble. And I did tell you that I would show you a variation. The variation for a stainless steel crown is shown on tooth number 30. Just like the other crowns that we practiced, you outline the entire coronal portion of the tooth. And then, to indicate the material that it's made out of, we're going to put horizontal hash marks on the tooth. Now these horizontal hash marks indicate that the material that this crown is made out of is non-precious. So stainless steel is not a precious metal, therefore we use the horizontal hash marks. So when it comes time to chart stainless steel crowns, whether it's on a test or in lab, you can use either one of these symbols. The next charting symbol that we're going to practice is the symbol to indicate that a tooth needs to be extracted. The two most common symbols that are used are either a single diagonal red line that strikes through the entire tooth. That is shown on the left side of the screen. Or on the right side, we have two vertical red lines that strike through the entire tooth. Now you can practice both ways. Again, on a test or in lab, you could choose one way or the other. They're both correct. It's just when you get out into a real dental office, you're just going to follow the charting symbols that are already being used in that office. But this is a good way to introduce variations. So take a few minutes, pause this video, and practice charting teeth that need to be extracted. Now that you've had time to practice, this is what your chart should closely resemble. And you'll notice that I use the two vertical red lines through all of the teeth, but I did keep the variation of a single diagonal red line on tooth number 30. The next symbol that we're going to practice is for a missing tooth. Now, a missing tooth is generally considered a condition. Because it's a condition, these are typically charted in black. And simply to indicate a missing tooth, you're going to place an X over the entire tooth. So take a minute and practice charting missing teeth. This is what the missing tooth practice should look like. Again, because missing teeth are a condition, I would like you to chart them in black. Some offices will chart them in blue. Now this was just for practice. We X'd out all of the teeth in this upper left quadrant. Typically, if a patient is edentulous, meaning that they're missing all of their teeth, instead of taking the time to X out each individual tooth, you would usually X out the entire arch. You'd X out the entire maxillary arch, and then you would X out the entire mandibular arch. The next symbol to practice would be an impacted tooth. Here I have an X-ray that shows you 5 different impacted teeth. Now most often it is the wisdom tooth or teeth that are impacted, but in this X-ray we have a very good example that in addition to those wisdom teeth we have what looks like a canine tooth that is impacted. Now, impacted teeth are again a condition, so I would prefer that you chart them in black. However, it is common for offices to chart impacted teeth in red. They chart impacted teeth in red because it's a condition that typically needs treatment. You don't just want to leave an impacted tooth stuck in the jaw or gum tissue. It can cause problems. So that's why some offices choose to chart impacted teeth in red. Now, to indicate that a tooth is impacted, you simply encircle the entire tooth. So you draw a circle, or in this case an oval, around the tooth that is impacted. So take the time to pause the video and practice charting impacted teeth. Now that you've had a chance to practice charting impacted teeth, this is what your practice chart should look like. Again, because it's a condition, I've charted mine in black, although keep in mind it is common for some offices to chart impacted teeth using red. The next charting symbol that you're going to practice is for a root canal. Root canals are typically abbreviated RCT, and that stands for root canal therapy. I have 2 X-rays on the left side of the screen. They show a root canal before treatment and then after treatment. And you can see in the after treatment X-ray that it's very obvious that a root canal was done. We have very opaque white lines running down the canal of the tooth. Now, the one thing you want to be careful with when charting a root canal is getting the proper number of canals placed on the tooth. Now, some of your charts might have anatomically correct roots, but others will not. For example, the ones we're practicing with today do not have fully drawn anatomical roots. So again, this is a good refresher on oral anatomy, remembering how many roots are found on each tooth. For example, a mandibular premolar is only going to have 1 root. However, a maxillary molar will have 3 roots. So take the time to pause the video and practice charting root canals. Okay, now that you've had time to practice charting root canals, this is what your chart should resemble. Remember, anterior teeth all have 1 root. maxillary first molars have 2 roots, so that's why I have 2 red lines here. The maxillary second premolar typically only has 1 root, therefore I only drew 1 root canal line here. And of course the maxillary molars each have 3 roots, which I've indicated here with 3 individual lines for each tooth. The next charting symbol to practice is a periapical abscess. On the x-ray on the left side of the screen, the red arrow is pointing to what looks like a little bit darker gray area, and that is typically how a periapical abscess shows up on an x-ray. Now, to indicate a periapical abscess on a tooth chart, we're going to draw a circle as close to the apex of the tooth as possible. Now, because we do not have anatomically correct roots on our charting, we're just going to estimate where the apex would be located. Now, periapical abscesses are a condition, so you can chart them in black. Just be aware that some offices choose to chart them in red because we don't want to leave an abscess, which is an infection, in the mouth. It's a condition that needs treatment, so some offices will chart periapical abscesses in red. So take the time now to pause this video and practice charting periapical abscesses. Alright, now that you've taken the time to chart periapical abscesses, this is what your tooth chart should closely resemble. I took the liberty here to chart both in black and red. Now, if this were a real dental office, they would never switch the colors like that. They would either stick to black, if that's what they've been using, or they would stick with red, if that's what they've been using all along. Now, the benefit to a completely anatomically correct chart is on multi-rooted teeth, typically the abscess is only on one of the apices or one of the root tips. So I took the liberty to draw roughly what the 3 roots would look like on tooth number 15, and where I placed my periapical abscess symbol is on the palatal root. So if you have a completely anatomically correct tooth chart, you're able to distinguish which root that periapical abscess specifically belongs to. The next charting symbol that you're going to practice is a post and core. Post and cores are used if a tooth has been badly fractured and there's not much tooth structure to hold on to restorative materials. The post is what goes into the canal of the tooth, and the core is what sticks above the tooth into the coronal portion. So on an x-ray, we have a post and core indicated here by this bright white area. It shows up bright white because it's made out of metal. And then we have a photograph of a post and core. We're looking at the occlusal surface of a tooth, and this silver area is the post and core, specifically the core portion that is sticking out above the coronal portion of the tooth. The dentist would then add material like a composite to bulk up the tooth before they put a final restoration in place. When it comes time to chart post and core restorations, they look similar to a golf tee. The post is drawn into the root of the tooth, but you want to be careful, don't draw it all the way down to the apex because the post only goes a few millimeters deep into the root. and then you want to indicate that the core is a little bit thicker than the post. This one is in red because this is a post and core that needs to be done. So take the time now to pause the video and practice charting your post and core symbols. Now that you've practiced post and core charting, this is what your practice chart should look like. Again, the post only goes a few millimeters into the root of the tooth, so it should end just before it reaches the numbers indicating the tooth number. And the core of the symbol should be slightly wider. So since these are all on the lower left quadrant, they kind of resemble golf tees. The next symbol that you're going to chart is a condition, and this specific condition is a rotated tooth. Now, teeth can be rotated either genetically, they can erupt in that position, or it could be caused by trauma. We're going to indicate rotated teeth by using a black arrow. Because it is a condition, we want to use black. I know your book uses red, but for our exercises, let's stick with black as indicating conditions. Rotated teeth specifically use a curved arrow, and the arrow points in the direction of the rotation. So if the tooth is rotated mesially, the point of the arrow will be facing the midline. If the tooth is rotated distally, the point of the arrow will be facing the distal side of the tooth. So take the time now to practice charting rotated teeth. Now that you've had time to practice charting rotated teeth, this is what your charting example should look like. So in this example, teeth numbers 17 through 20 are rotated distally because the arrow is pointing away from the midline, and teeth numbers 21 through 24 are rotated mesially, and we know that because the arrows are pointing towards the midline. The next condition that we're going to chart is called a diastema. Diastemas refer to unusually large spaces or gaps between two teeth. We indicate a diastema by using two vertical lines placed between the teeth that have the space. Because this is a condition, I would like you to chart diastemas in black. Typically, a diastema is formed between the central incisors. This is because the patient might have an unusually large or thick frenum. So your book shows an example using two red vertical lines, but because this is a condition, please chart your diastema using black. So take the time to practice charting your diastema. For your example, you only have one to chart, and this is what it should look like. You really have to kind of squeeze it in on this tooth chart because the teeth are right next to each other. But between numbers 23 and 24, we have two vertical black lines indicating a diastema. The next condition that you're going to chart is the symbol for a drifted tooth. Drifted teeth are indicated by using a straight arrow, and again, the point of the arrow is going to face the direction of the drift. So if the tooth has drifted distally, the arrow will point towards the distal side. If the tooth has drifted mesially, the arrow will point towards the mesial side. So pause the video and take a few moments to chart drifted teeth. Now that you've had a chance to practice charting drifted teeth, this is what your chart should look like. Numbers 17 through 20 are drifted distally, and 21 through 24 have drifted mesially. Now, typically a patient would have drifting if they had an extracted tooth and did not replace the missing tooth. The adjacent teeth, if a tooth had been extracted, the adjacent teeth tend to drift into the open space. The next charting symbol that we're going to practice is a fixed bridge. The bridge that we're going to practice charting in our example is a fixed bridge that is made out of porcelain fused to metal. So this is similar to the crowns that we've charted, but there is a key difference. Bridges are used to replace a missing tooth. Now there are components of the bridge that are called abutments. You can think of the abutments as anchors. The abutments are what hold the bridge in the mouth. The doctor will shape the anchoring teeth or the abutment teeth into little square pegs, and the bridge, once it has been fabricated, will be cemented in place over those prepared teeth. Once it's cemented in place, it's there permanently. All units, each tooth of the bridge represents a single unit. So in this example, it's a 3-unit bridge. All units are connected. So in the top picture, we just have a diagram. In the bottom picture, we have an X-ray, which shows a 3-unit bridge. It shows the abutment teeth, which are the anchor teeth. And then the tooth that looks like it's floating, this has a specific name. It's called a pontic tooth. So our bridges have abutments. The abutments are what anchor the bridge to existing teeth, and the pontic is the false tooth that replaces a missing tooth. So bridges can be more than 3 units. I've seen 6-unit bridges, 7 and 8-unit bridges in some cases. So you can have more than 3 units. It all depends on how many teeth are missing in that patient's mouth. Now, to chart a bridge, you first want to indicate that there's a missing tooth. And for our purposes, we're going to use a black X to indicate a missing tooth because that's considered a condition. Then we're going to outline the coronal portion of all teeth that are involved in the bridge. So in this diagram, there are 3 teeth involved in the bridge. Now you even draw on the missing tooth, because there's going to be a pontic there, so you want to indicate that. So for your bridge, you're going to outline all coronal surfaces of the teeth that are part of the bridge. Then you're going to pay close attention to the material that the bridge is made out of. This one is porcelain fused to metal. When you think back to charting a PFM crown, if you remember, you place diagonal hash marks on the lingual surface of the crown. The same holds true for a bridge. If it's a PFM bridge, you're going to place diagonal hash marks on the lingual surface. Now, the one key difference here is you're going to place connecting lines that indicate that these three teeth are fused or connected together. So between the three teeth, you're going to draw connecting lines that show that these three teeth are connected together. Now we're going to go through a few more charting symbols before you get to practice them. So just hold tight before you jump into practicing your fixed bridge. Alright, the next symbol that we're going to cover is for an implant. Implants are another way to replace a missing tooth. In the example that we see here, this is an implant replacing a single missing tooth. So this is an alternative to a bridge. Implants are simply a titanium screw that are threaded into the bone. It's allowed several months to heal. A special cap is placed on top, and that cap then has a crown cemented on top of it. So this top picture is a diagram of an implant. The bottom picture is an x-ray of an implant. And they're very unique looking. You can actually see the threads of the implant. Those threads are important when it comes to retaining the implant in the bone. Now, to chart an implant on our tooth diagrams, we're going to indicate that it's an implant by placing horizontal lines on the root of the tooth. These horizontal lines represent the threads of the implant screw. Now, typically you'll also complete a crown on top of an implant. And of course, you're going to follow the same charting rules that we've already covered for crowns. But this diagram specifically only shows you the actual implant charting symbol. The next charting symbol that we're going to cover is for a veneer. Veneers are typically made out of porcelain. There is no metal found on a veneer. That way, the translucency of the porcelain looks very natural. And another unique characteristic of a veneer is that they are only placed on the facial surface of a tooth. Here's an actual photograph of a veneer. The veneer that's on the left side, what you're actually looking at is the part of the veneer that's going to be cemented onto the tooth. When you flip this part over, it looks like the veneer on the right side of the picture. So this, what I'm outlining with the cursor, is the facial surface of the veneer. And you can see the translucent edges that will let light shine through and make the veneer appear very natural. Below in the photograph of this person's smile, we have small, slightly yellow teeth. We do have a diastema present, and this person chose veneers to change the appearance of their smile. Their teeth are now larger, brighter, and lighter in color. So veneers are very nice to change the appearance of a person's smile. When it comes to charting a veneer, you simply outline the coronal portion of the tooth that is on the facial side. Remember, veneers only cover the facial side, so that's the only part of the crown that we want to outline. This one's in red, so this shows that a veneer needs to be done on this specific tooth. The last symbol that we're going to discuss before you have a chance to practice these last 4 charting symbols is a fracture. Now, teeth can fracture due to trauma or stresses on the tooth. If someone constantly chews ice or popcorn seeds, they can be more prone to fracturing their tooth. The images here show both a maxillary anterior tooth fracture, and this is a mirror held in the mouth, so what we're actually looking at is a reflection of a mandibular molar. Right here it looks like an entire corner or cusp of the tooth has fractured away. That's common. You can see a restoration in place here. This person has a composite filling, and the tooth is probably weak, had a hairline crack, and maybe that person bit on a bone accidentally or was chewing some ice, and the weakened cusp tip just fractured away. To indicate a fracture, fractures are a condition, so I would like you to chart them in black. You draw a jagged line on the surfaces that the fracture took place. So in the diagram shown here, the fracture is indicated on the mesial, facial, and incisal surfaces. So this here is an MIF fracture. Now again, you'll find variations with fractures, especially with the color that is used. Some offices will choose to chart fractures using red because you don't just want to leave a fractured tooth in the mouth. It is a condition that requires a restoration. So typically they will chart it in red because it needs to be fixed. But for our purposes, we're keeping conditions simple and charting all conditions in black. Now you have a chance to practice your last practice charting, and for these last 4 items, the bridge, the implant, the veneer, and the fracture, you have a complete tooth chart. So all 32 teeth are present on your tooth chart. So pause this video and take a few minutes to chart the fixed bridge, the implants, the veneers, and the fractures properly. Now that you've had a chance to practice charting those last 4 symbols, this is what your last practice tooth chart should resemble. So take a moment to match what you've drawn on your tooth chart with what you see here on the screen.